All right, you guys, I don't really have a case study for this, but I do something in class with it, so I'm just going to talk about it here. It can't hurt to go over the material again. I am looking, you have this chart on page 1343. It's the nephrotic syndrome chart. I talked about it when I lectured on nephrotic syndrome. But again, just go ahead and look at this. I can't remember. I think I was saving this at the time because I thought we were going to come back to campus and review. So could be some repeated information, but at least you're hearing it again. All right, so again, I talked about nephrotic syndrome because it's the most common presentation of glomerular injury in children. And if you're looking at the diagram on page 1343, the first box says renal glomerular damage. So we've got some changes in the glomerular membrane that causes the membrane, it becomes permeable to proteins, especially albumin, which is lost in the urine. So we see lots of urine or lots of albumin in our urine, so hyperalbuminuria, but then we have a decrease in albumin in our blood, so hypoalbuminemia, okay? And then let's see here, we talk about, I'm looking at the chart again. So we talk about hypovolemia. So they're losing volume. We've got decreased renal blood flow. Renin is released, vasoconstriction, and then we can go down the other side and it talks about increased secretion of ADH and aldosterone. But the big thing that you're worried about there is that hypovolemia. And what that hypovolemia does to the body. We talked about our blood pressure changes and then how our heart compensates. Don't forget your signs and symptoms with nephrotic syndrome: decreased urine output, dark foamy urine, pallor, fatigue, anorexia, diarrhea, increased susceptibility to infection. Let's see, another issue is the hyperlipidemia, which is on the chart. And remember, that's thought to be because of liver increases the synthesis of lipoproteins. It causes both protein, lipids, and fat. It causes both protein, lipids, and it allows fats to move. Let's see, the other issue on the chart is your edema. Don't forget, their shoes feel tight, their clothes feel tight. On kids, usually starts in the periorbital, and then it can lead to total body edema, which is anasarca. Don't forget, if we have edema, our weight will go up as well. Your other issues are the fluid volume excess, nutrition, skin. Skin is an issue because of that edema and because of immobility. The other issue we worry about is infection, and then the activity intolerance. So that's just kind of going over that chart again on page 1343.